Integumentary System Medications lecture. So there are many disorders and diseases within the integumentary system. Some of the ones you will need to be familiar with are acne, nevus, furuncle, eczema, psoriasis, rosacea, impetigo, thrush, athlete's foot, ringworm, alopecia, scabies, herpes simplex 1 or 2, and then carcinoma or melanomas. Categories of medications: we have antipruritics, corticosteroids, emollients, keratolytics, enzymatic agents, scabicides or pediculicides, local anti-infectives, burn medications, and acne medications. Antipruritics relieve itching, pain, and irritation. The uses are mainly for any kind of dermatitis or eczema. Some common medications are benzocaine or Oragel, diphenhydramine, which comes in not only a pill form for allergies, but also in lotion, creams, gels, and sprays, diproline, Lidex, Topicor, or Kenalog, and then triamcinolone cream, which is probably the most common that you will see on a patient's medication list. Topical corticosteroids treats disorders associated with allergic reactions, psoriasis, and seborrheic dermatitis. Medications that we often use are hydrocortisone or dexamethasone. Emollients and protectants are applied topically to soothe, soften, and protect or seal out wetness. Uses are for diaper rash, irritation or abrasions, and minor burns. Medications are vitamin A, D ointment, Desitin, which is vitamin A and D with zinc oxide, and then we have zinc oxide by itself, also called Balmex. Keratolytics control abnormal scaling and promote peeling. They should not be applied to open skin. They are often used in conjunction with antifungals for seborrheic dermatitis and dandruff. The uses of keratolytics are dandruff, seborrhea, psoriasis, hard corns, calluses, and warts. Some of the medications are coal tar or Neutrogena T-gel, salicylic acid such as Clearasil, Fostex, and Compound W, or sulfur. In psoriasis, we often use a combination of treatments. This is oftentimes hard to fight. We will use corticosteroids, antihistamine, salicylic acid, and phototherapy, such as recommending a patient to go to a tanning booth for treatment. Some oral or injectable medications that we can give for psoriasis are methotrexate. Patients with severe psoriasis can often have injectable immunotherapy, such as medications such as Enbrel, Humira, Remicade, or Stelara. Enzyme preparations are chemical debridement of necrotic tissue, are used in patients with diabetic ulcers and bed sores. The common medication is collagenase or Santal. Scabicides and pediculicides. Scabies are caused by an itch mite that burrows under the skin. Scabies is treated with permethrin 5% or Lindane shampoo. Pediculosis is an infestation of lice on the hairs. Pediculicides are treated with permethrin 1% or RID. Lindane shampoo, Skilice or Ridex. It is important to instruct patients to follow the package inserts. Many of these medications are over-the-counter. Skill Ice, I believe, is prescription only. When patients are being treated for lice, it's important that they use the treatment right away and then 7 days later. And also it is important for both of these that bedding and clothing is washed in hot water and dried for at least 20 minutes. Topical antifungals treat fungal infections. So toenail fungus is often treated with terbinafine or lamictal. Thrush is often treated with nystatin. Athlete's foot, jock itch, and ringworm often treated with clotrimazole or Lotrimin. Dandruff is often treated with ketoconazole cream or shampoo. Vaginal yeast infections often treated with Monistat or Lotrimin AF. Antivirals treat viral infections, which are warts. Oftentimes in the office we will use liquid nitrogen to freeze and damage the tissue. That will then eventually be sloughed off by the body. Or we will treat it with a salicylic acid. Sometimes this is not as effective, especially in our larger warts. Herpes simplex 1, which is typically our cold sores, is treated with acyclovir cream or ointment, or Abreva. Abreva protects the cell well and prevents the spread of additional cold sores. Shingles is often treated with valacyclovir. Sometimes it will be treated with acyclovir, but valacyclovir is the mainstream medication for this. To be most effective, it should be taken by the patient within 48 hours of noticing the rash, but can be up to 72 hours. Herpes simplex 2, also known as genital warts, can be treated with acyclovir or valacyclovir, which are both oral medications. This does not get rid of herpes simplex 2, but lessens the symptoms. Topical antibacterials treat bacterial infections. Impetigo, which is highly contagious, is treated with mupirocin or Bactroban. Acne, there are many different types of medications that treat acne, and oftentimes it's a trial and error with a lot of these medications. But some of the more common ones seen are dapazone 5% gel, benzoyl peroxide, which can be over the counter, benzocaine gel, which has clindamycin and benzoyl peroxide 5%. Sometimes this medication can be very expensive, so the alternative would be to give the patient clindamycin oral as an antibiotic and then buy the benzoyl peroxide over the counter. Cleocin, which is clindamycin and isopropyl alcohol, Differin gel, retin-A or tretinoin are often treatments for acne. Other treatments for acne that are not in gels are oral antibiotics such as doxycycline or tetracycline. Oftentimes too, especially in adolescent patients, when acne is present, we will, if they are female, we will put them on orthotricycline or orthotricycline low, which is a birth control that controls the hormones that could be triggering the possible acne outbreaks. And then we have burns, where we would apply Silvadene for possible bacterial infections or to prevent bacterial infections. Antiseptics inhibit the growth of bacteria. One of the medications is chlorhexidine, which is either Hibiclens, which is a skin cleanser. We use this oftentimes in minor surgeries or if we are accessing a port. Pruritics is an oral rinse that is used, oftentimes used for gingivitis. And then we have povidone iodine, which is used to cleanse the skin in surgical procedures or minor surgeries.